Welcome to the Prep Doctors ACJ live info session, everyone. My name is Isha Soni. I'm in the marketing department, and today we are joined by Dr. Marwan Al Rayes. He is the head instructor at Prep Doctors. Everybody knows him. Welcome, Dr. Marwan.
Thank you
so much for joining us.
Thank you. Welcome, everyone.
So, Dr. Marwan, this session is focusing on the ACJ exam or the Judgement exam. Can you start by telling us something about the format of this exam?
Okay, so I'll talk a little bit about the ACJ exam. It comes after the AFK.
Mm-hmm.
So in the AFK, people are used to the simple, straightforward, multiple choice questions.
Mm-hmm.
And it's fundamental knowledge. So they move on to the second phase, which is the assessment of clinical judgment.
Right.
And this exam, the format is totally different from the AFK.
Mm-hmm.
The content is part of the AFK, but it's much less than the AFK.
Mm-hmm.
So the format, you have a question that has so many choices, and then they ask you to choose one or more.
Okay.
And if you choose the wrong answer, it can cancel your question.
Mm-hmm.
So in another way, they're telling you that before you make a decision, you have to be 100% sure, because otherwise you're going to pay a price to it. So it becomes challenging for people to know when to stop. They want to know when to stop, and there's usually more than one correct answer. So one thing that they face a challenge with is, what's the most important answer?
Mm-hmm.
2 is, should we take that risk and choose more, or should we stop? And this is pretty much the challenge of the ACJ, is the format, not the content. If you look at the content, everyone knows the content. They have been through the AFK, the clinical part they've already been familiar with.
Mm-hmm.
But the minute you apply it,
Mm-hmm.
it becomes a difficulty.
Right. So, Doctor, that's a great explanation of the format. As you said, it is the next exam, or ideally the next exam after the AFK, and it is a different format of studying and different style of studying. How different should the approach to study for this exam be?
I think the way they should be studying for it is more practice
Mm-hmm.
than studying, because people always, they like to read. So one of the most common questions we get is, give us a lot of references, let's read more and read more. And what's going to happen is, when they read more,
Mm-hmm.
they're going to confuse themselves more, and then they're not going to be able to arrive at the right conclusion. It's more of a practice and applying the knowledge than gaining knowledge. They've already gained the knowledge,
Right.
so they just have to apply it. So in terms of studying or preparing for this exam, it's practice.
Mm-hmm.
Half of the exam is x-rays.
Okay.
Okay, and we have a large portion of the foreign trained dentists are new graduates.
Mm-hmm.
So we know when we first graduated from university, it used to be difficult even to orient an x-ray. You struggle with that.
Mm-hmm.
So now you are at a stage you have to interpret that x-ray. So that comes with experience.
Right.
If you compare someone who has 10 years of experience versus someone who just graduated,
Mm-hmm.
the 10-year experience, it's a piece of cake. He can look at a cavity, he can spot it because he's been working in clinic for 10 years. The new grad is going to have a difficulty. He wants more technique, more tricks. How can we detect that? And it comes with experience. So the more practice they have,
Mm-hmm.
the better they're going to get at it. Similarly with cases,
Mm-hmm.
to not only practicing cases, but also trying to focus more, to increase their level of focus.
Mm-hmm.
There are actually, if you look at psychology of the human being,
Mm-hmm.
there are programs, there are ways to train yourself to increase your focus. What's the difference between this exam and real life? In this exam, every piece of information that's written, you have to take it into account.
Mm-hmm.
In real life, you have a live patient sitting in the chair who's gonna tell you
Mm-hmm.
what to do.
Right.
So a lot of times you don't need to focus as much with the patient because it's a dialogue. So if you want to anesthetize the right side, he's pointing to this side, you're gonna go right away to this side. But in the exam, you have to match right and right.
Right.
It's more like words.
Okay.
And losing focus can cost you a lot. Sometimes simple questions, sometimes people, they come out of the exams, they tell me they're discussing with their friends some answers and so forth.
Mm-hmm.
They find out there's a piece of information they did not realize in the question, and that threw the whole question away. So practice, focus is the key in this exam.
Okay, that's great, doctor. Um, Doctor, since this is one of the most difficult exams in the equivalency process, there's a lot of talk about, why this exam is so difficult, and what are there any changes or any updates that are coming in that are making this exam difficult to pass? Can you tell us something about that?
It's very tough to answer that question. It's a very tough question, but here I want to focus on the people, and I'm gonna focus a little bit on the history of this exam. It wasn't the most difficult part of it. It wasn't the most difficult exam in the past.
Okay.
If you look at the statistics, you find that going from 2011 all the way to 2016, the passing rate of the NDEB was increasing. It was going from 50%, it got to 75.
Okay.
Then all of a sudden in 2017, it was dropped to 35%, around 35%.
Wow. All right.
And this year, it climbed up again to 43%.
Okay.
And from my experience dealing with foreign trained dentists, what I realize is that usually people who unfortunately failed the first time, they struggle the second time. Fresh people, they have a better chance at passing because they still have not developed that fear from the exam. People who failed the exam, because they don't know where they went wrong, they start to look for where did we go wrong. And a lot of times when they take it back to back, they're still stuck in the same mind frame.
Right.
I'll just use another example. For foreign trained dentists are familiar with this test, the IELTS. A lot of times when you take the IELTS exam, if you take it so close, you find that you study harder and then you find you're scoring the same every time, you're scoring the same.
Right.
What's happening? Why they're not improving? Because they're stuck. They're answering the questions the same way. Now, if you look at the courses they actually provide for the IELTS, what do they do when they teach this? When the person takes a new course, they say there's a new course. They just change the order of the chapters. They try to change the mind frame set of this person. The person still has the same information. He still has the same skill. They go in and they do better. So, foreign trained dentists in ACJ, especially those who are repeating, they have to change the way they're thinking. And the reason I'm saying this because when I give a lecture for ACJ, you find that some people actually, the way they're approaching the exam is totally wrong. They're approaching the exam as if there's a tricks behind the scene. They're always trying to find out where is the hidden trick, where is the difficulty here. And the question is so straightforward. So they make a story behind the scene to answer the question. They create a story for themselves.
Right.
And sometimes they also have this misconception that dentistry in Canada is different from dentistry in the other parts of the world. It's the same human we're dealing with. So sometimes I stop him and I tell him, okay, in your clinic, what would you do? He will answer the right question. He will give the right answer. The minute you put it in a ACJ format, he can't, because he is not used to this simplicity in answering.
Right.
So I feel that the people complicate things. And when they come out of the exam, they always try to look for what is wrong with the strategy. And here I always do a lot of research after the exam because I want to help people to clear this exam, especially with the low percentage. So I don't want to give people false hope. They have to find out what's really wrong. So I do a lot of research. I ask people, how did the exam go? What did you feel, and so forth. In terms of knowledge, they are prepared. They know the content.
Right.
Now, when I talk to them, okay, how did you approach the exam? Some of them they say I was conservative. Some of them they say I was aggressive. Now, what's the definition of conservative and aggressive? Still, that's a very vague area. But I'm gonna give an example of two people who scored, I think one person 85, one person 87.
Okay.
The person who scored 87, she told me I was extremely conservative. I answered one option for each question. Even in x-rays, I was answering one. At max 2. Okay? Now, I spoke to the other person who got the 85. He said, no, actually, I felt I had to answer more, so I was going for 3 or 4 answers.
Wow.
Okay? And that tells you something that's very valuable. They both hit the right answers. And this person, he actually answered maybe benign answers on top of them. He didn't go into the -1. But people, when they come out of the exam, a lot of them, they don't ask themselves the question, did I answer the wrong answer? They don't ask themselves that question. They ask themselves, did I answer enough or did I over answer?
Right.
But sometimes it's not about this or that, it's about just not hitting the right answer. And they should know this, because when they discuss answers with themselves, they find there's a big discrepancy. And sometimes even when they're discussing with each other, they discuss totally different quizzes and there's different information. So perception, the difference in perception is huge in this exam. And the psychology with it, the fear. So usually those who go the second time to the exam, now they're going, they have not found the real reason why the first time they did not do well.
Right.
So they're going the second time to try something new. They want to try something new. Maybe it will work, maybe not.
Right.
But they're not trying the right thing. The right thing is focus on the right answer. If you get the right answer, our approach here is we always preach for to be conservative, to choose the most important answer, but it has to be, I always tell people, it has to be the right answer. And we try to be conservative, meaning that don't go into answers that don't make a big difference. So for example, to give you an example, when we're talking about perio disease, right? So someone who has gingivitis, what's the management? If I give you two answers, one is oral hygiene instructions and non-surgical debridement. The main answer is non-surgical debridement. You have to do the therapy. But some people, they get scared to a point that they go with the oral hygiene instructions. Well, that's not going to give you marks, not going to make you lose marks. It's not a big deal there. But you have to get the most important answer. And a lot of times there's one main important answer that's going to give you the bulk of the mark.
Okay.
So those who miss it, this is where they start losing the mark. The other thing that I get from people is some people, they say, well, the toughest part was perio in the exam. Another person will say all the exam was perio. And then you hear all the exam was pharma. And I tell people the percentages are already split. The NDEB have determined what's the percentage of each discipline. But it's perception. Because let's say someone is weak in perio, what's going to happen in the exam? Every time they face a perio question, they get stuck. Then they go to the next two questions, they answer them so quickly, then they get stuck in perio again. So they exit from the exam, they say, it's all perio. Right? Same thing in AFK, we hear people saying it's all this discipline because they're stuck in this discipline, but the percentage of distribution is what NDEB have determined.
Great. That's
sorry, I should allow them to ask because I've been talking for a while.
Right. No, in fact, this is amazing information because you're sharing with them the perception that is required for them to go into the exam, the correct approach, and these are, I think, the most important factors because
it's important. People, they come to ask me, what should I do? I say, when they take the course with us, for example, they say, should I go? I tell them, do you see a difference in yourself? If you're going to the exam, you don't know what's wrong, still, with your approach, that means you're gambling.
Absolutely.
Yeah.
That's great information, Doctor. Thank you so much for this valuable advice. And that brings me to my next question. You already threw a little bit of light on this, but can you tell us something more about our approach here at Prep Doctors towards the prep for the judgment exam?
So, what I do usually for the assessment of clinical judgment is I like to make people think. When I do the lecturing for the ACJ, I put a lot of cases in between.
Okay.
This year I'm trying something new. I'm switching the x-rays to the beginning, not the end, so people have even more time to practice x-rays. So we're gonna be constantly reviewing x-rays because I noticed this is an area of weakness for many people. But the idea is I want people to think. So usually when I start with the course, I make people give me the answer without looking at the answers themselves. Then I start to build in the multiple choice format and so forth. But we have a mix of, usually the class is a mix of two type of people, and you have to target both. You have new people who just finished the AFK, and for those people you have to set the foundation, you have to teach them judgment.
Right.
And then you have people who are repeating or doing the exam for the second time. And those people, they're coming to the class, they want answers to specific questions. They're not coming to learn the material, they're coming for specific answers, and that sometimes creates confusion, so you have to control it. So what I do usually is I have to set the foundation, but I try to do changes, bring new cases, approach things from different angles, just so that for those who are repeating, they get a different experience. Because I don't want them, because if I repeat exactly the same way, then I'm doing the IELTS example.
Right.
Yeah, as people are still in the same loop.
Absolutely.
They come here, they're used, because if they've taken, let's say, the course with us before, they're already used to the style, to the approach.
Right.
So they're gonna come, they're gonna keep practicing the same thing, and I want them to figure out what's wrong in their exam.
Right.
Yeah, so only when you throw it from a different light, when you change things, when you mix things up for them,
Right.
it will give them that extra practice and
That's-
extra experience.
Right. That's great, Doctor. And Doctor, I have actually sat through a few of your classes, and I think they're great. And especially, I'm in the marketing department, so I don't sit in his classes from the dentistry point of view. But I do know that you talk about
So you
thinking
think they're
of
great because of the jokes, not because of dentistry? 'Cause
those
you have
two.
no clue what's
They're
going
very
on.
enjoyable. they're really enjoyable. But Doctor, I do notice that you ask the doctors to think of it like they are in the clinic. Can you explain something about that process where you ask them to go back to the clinic, think of it like they're actually dealing with a patient?
Well, this is an important part, but also it can be dangerous.
Okay.
Okay, because there are some techniques that we do in clinic that are not the right techniques.
Okay.
So that when it becomes, it's a fine line. You have to actually draw that line.
Okay.
But the majority of cases, when you think about it, if it's a patient in the clinic, how you're gonna handle that patient, it's gonna lead you to the right approach.
Right.
In anesthesia, whether we're talking about anesthesia, we're talking about medical emergencies and so forth. What would you actually do in your clinic to save this patient? You're gonna arrive to the right answer. For those who have experience. For those who
Right.
don't have experience, they have to learn it from the cases.
Right.
But I use this approach a lot of time when I have a debate in class. Because I know when I ask a question and he's arguing, the minute I tell him, if you were in clinic, what would you do? His answer is gonna change.
Right.
But he's debating because he's afraid that there is a trick and he wants to capture that trick. So I tell people this: read the lines, don't read between the lines.
Yeah.
Read the lines. Make sure you read all the lines in there, but don't read in between the lines. Don't make up things. Just take whatever is given to you, apply it, you're gonna hit the right answer.
It's right in front of you.
Yeah, right in front of you.
Right. Great, Doctor. Doctor, we have dentists joining us from all over the world, from across the globe. We got so many messages from them. We got so many emails with questions for you. The response has been amazing. I'm sure they're watching right now, and I'm sure more of them are going to watch later. For them who are unfortunately not going to be able to join us at our classes, would you have any advice to help them prepare academically and emotionally to approach the ACJ exam?
That's a very tough question. So they want to prepare in their country and then come to do the exam?
Yes, Doctor.
Oh, yeah. It's a tough question to answer because preparation for the knowledge-wise, the references are there. They've already prepared for clinical, for the assessment of fundamental knowledge, so they do have the knowledge, they do have the background. In terms of practicing the cases, I would say the best thing is if they actually go to the NDEB website. Over there's a very good outline of what the exam is like, so they can get an idea about that. They have to be familiar with the format of the exam, so they can go to the examples that the NDEB have provided, see the format, and try to focus their studying on that format. They can come up with their own cases. So usually we say studying for a judgment comes from the approach is what if. They have to put the what if scenarios. So what if a patient fainted and then they find an answer to it? So what if? So they create their own cases and they find the approach on how to solve it. Now, it's much easier if they're able to come. The reason is if they're able to come, they can actually, there's groups of people studying, they have access more to the practice and so forth, so that's going to help them out. The other thing, the reason is when someone tells me, well, should I study by myself for this exam? And I don't like to tell people yes or no, because it varies from one individual to another. Some people, they have experience, they know how to handle these questions, they're fine. Other people, they need the practice, so I'm not in a position to tell, okay, yeah, you have to take the courses, you have to do this. Some people, they're fine. But the only thing that I have a strong advice for people is get as much information as you can about this exam through friends.
Right.
From those who are in Canada.
Mm-hmm.
So they should have a connection in Canada. Don't go to the exam without having a connection in Canada.
Right.
Get whatever information you can, because first of all, you want to pass from the first time, so you avoid that trauma.
Right.
Because that trauma is going to make it even more difficult.
Yes. Yeah.
And you have limited number of attempts. 3 attempts.
3 attempts.
The surprising thing is sometimes I get people in AFK and they say, well, the first 2 times I've given the exam, I didn't study. Why did you do that? Well, I thought maybe I'll get lucky. Okay, well, now you have one more chance. You're left with one more chance. So
Right.
I don't like people to go through that, and this is why even if you notice from the assessment of clinical skills,
Mm-hmm.
a lot of people, they're afraid when I come and sit with them, because I'm very blunt. If I see they're not ready, I tell them, you are not ready, because you have to be honest with yourself and with them. It's better to make them try now than to see them again and deal with bigger
Yeah.
issues.
That's true. That's good advice, doctor. This is a question that came into us via email. Is there any additional study material other than the prep doctor's course material that you would recommend?
Okay. There's a lot, actually. If you go and look for the references, there's 200. So there's a lot of material, but even more than 200 maybe. But the idea is, it's not about, in clinical judgment, it's not about how much you study. And it has to be individualized. So I do get people, they say, I want additional material in ortho, for example. So I direct them towards ortho references.
Right.
But it's a very open-ended question, because additional material, you're talking about dentistry.
Okay.
So there's a lot of material in dentistry, but they have to find out their weaknesses.
Right.
So if they want additional imperio, so that's something when they come and ask me, I say, in what discipline do you want this additional material? For example, in AFK, they say in pharma, we want a reference in pharma, but they're good in restorative. They don't need additional references in restorative. So it varies from individual to individual.
Okay.
And if they feel weak in one area, we can direct them to specific references for that.
Okay, that's great, doctor. So I think we are coming to the middle of the session. We're starting to take our live questions. So doctors, feel free to ask your questions. We already have a lot of questions coming in the comments below. Feel free to send us your questions. Dr. Marwan, the first question comes from Dr. Khoja. Do you think 2 months are enough to prepare for the ACJ?
Okay, now I have to ask Dr. Khoja questions.
Sure,
Right?
you can take it
To
with
find
Dr.
out if it's
Khoja.
enough or not. I think it is enough in terms of material, but they have to practice. Now, it varies from new grad to someone who's experienced, from one individual to another, but for the majority, 2 months is enough to prepare.
Okay.
Actually, is more than enough time to prepare, because the material is not much.
Okay.
The practice is what they want to do. So
Alright.
they have to practice more and more, and I think 2 months is fair amount of time to prepare for the ACJ for
Okay.
majority of people.
Okay.
Yeah.
All right. That's a great answer, doctor. We had one more question that came to us via email. It was about are there any more updates in our approach this year to the exam? You did mention about getting the x-rays in earlier on, but
Yeah, so
anything-
not only getting the x-rays, we always have new x-rays, and I'm increasing the amount of x-rays. We're going to have more on tablets this
Okay.
year, ongoing, and we're starting with it so that people get this experience, they get to practice. Also, the course, we've changed a little bit the number of sessions of the course. We
Okay.
increased the sessions, and we're going to dedicate from every session a little bit on radiology, just so people get that continuous practice, because this is one of the areas of weaknesses.
Right.
And the other thing is make the course more PBL based, problem based learning. So we're gonna try to learn more from a problem based, so a cases versus theory. Limit the theory, increase the practical.
Okay.
Because people already are familiar with the theory.
Okay. Thank you, doctor. The next question comes from Dr. Mehru. Will you be teaching the radiology class? she asks.
Yes, I will be teaching the radiology class.
All right. So
Now, just to comment on radiology, because I always, you know how we get the feedback after the course and I talk to people. In radiology, I go all in radiology. So a lot of people say, well, you teach us stuff that it doesn't come in the exam. True, I'm going to keep on teaching these things because I teach a lot of anatomy, for example. I teach the foundations in pathology, although that people say they're not heavily focused in the exam, but it's to build that baseline.
Right.
Because you have to look at, some people, they look at something that's normal, they don't know it's normal. So before learning the abnormal, you have to learn the normal.
Absolutely.
So that's the approach we use here. And I do recognize that more practice is going to help them more. So starting with radiology, I think is going to make a big difference for people.
Great. The next question, doctor, comes from Dr. Kalab. Advice for people repeating the ACJ exam.
I always tell them the same advice. Find out without bias where you went wrong. Find out without bias where you went wrong. And I think people should be capable of finding out where they went wrong. And there's a lot of rumors about ACJ. ACJ, not only ACJ, let's put it this way, foreign trained dentists. Actually, if you're in marketing, right? So I'm going to give you a tip in marketing. If you want something to spread, tell one foreign trained dentist about it. Everyone's going to know about it. This is how it works. Everyone knows about it. The minute something comes out, so people talk. And everyone shares their own experience from their own perception. So it doesn't mean it's right or wrong. You have to look at where did you go wrong in the exam? Did you have enough knowledge? Review in your mind what you did in the exam. Were you stressed out? Did you run out of time? There's so many factors that could lead to a person unfortunately not passing the exam. One person I was talking to, she told me, maybe I did a shift in my answers. I said, how did you come to this conclusion, or why do you feel you might have done a shift in your answer? She said, because when I exited, they were discussing a question I did not see at all during the exam. So those things, they matter.
Wow.
And they matter, especially when you're talking about someone who got 74.
Right.
Yeah, they're borderline.
Absolutely.
So one question or even part of a question could have pushed him through.
Right.
So my advice for those who are repeating is, one, without bias, look, why did we go wrong during that exam? Try to find out. I'm here also, I talk to these people. I like to talk, I always tell them in course, people who are repeating, especially who are going to third attempt, I like to talk to them in person. Because I would like to also see at what level they are. I'm going to be very honest with them to see what's going on in their situation. Because we don't want them to end their career due to this exam. So find out why you went wrong. Also, I tell them, if you start studying again, you have to change a little bit. I think the reason people, they don't go through this exam is the way they think. So there should be a shift in the way they approach the questions and the way they approach the material. They have to shift that. If they find they're not shifting, there's a problem.
Right.
And how do they recognize that they're not changing or anything like that? Through practice. Like when they practice, when they go through mock exams and so forth, they'll be able to find, am I actually improving or am I stuck?
Right.
Yeah.
Okay. That's a great answer, doctor. The next question comes from Dr. Ayman Muhammad. He says, tell us more about the virtual course or the remote course in BC, in British Columbia, or should they come to Mississauga? Can we tell them that it's going to be the same experience? Please tell us.
Yeah, it's the remote course actually is exactly the same as the only thing I'm going to tell you and Uthman actually about this is, if you want to make it identical, people here have to ask through a mic. This is the only difference, because people over there, they hear live the session.
All right.
They get to ask questions through the microphone and I'll get to answer them.
Okay.
But the only thing that I found a disadvantage, which I hope you guys work on improving this.
Point noted.
Yeah, is people here when they're asking me a question, and sometimes when you're in the middle of the lecture, you tend to answer them right away. Right. I always try to remind myself, repeat the question. but it would be for them to feel
Right.
that they're exactly the same as
Right.
people here, is to make it mandatory for people who are, we have to get a number of mics, I think, and make it
Right.
mandatory for people who ask in Mississauga to ask through the mic.
Right.
This way,
They
it's
get
gonna
to
be
hear
exactly
it.
the same. There's gonna be absolutely no difference.
Right.
Yeah.
And they ask you the questions through their mics. You get them directly. You answer to
And
them
I would
directly.
be happy to give it from Vancouver, by the way, if you guys can fly me there. That would be nice.
It's the same, exactly the same experience, like you're sitting in Dr. Marwan's class.
But that's the
with
only
him.
difference. That's where people commented
Right.
is because they don't hear the questions here, they would like to hear what people are talking about here.
Absolutely, Doctor. We'll
Yeah.
start working on that right away for sure. And
we're going to Montreal.
Yes,
Yes,
we.
this cycle we're gonna be in Montreal.
Yes.
We have changes for next year, but I don't want to talk
Okay.
about it right now because next year it's gonna be more electronic. That's how the exams. It's no longer on
Alright.
paper, so that's a change that's gonna take place.
Okay.
So people who are doing it in December, they're the last people to do it on paper.
Oh, all right. That's
Yeah.
a good update. That's great, Doctor. And we're gonna announce what Dr. Marwan just said about Montreal. We are bringing the ACJ course to Montreal for this exam cycle. So the registrations will be starting sometime soon, maybe probably tomorrow. It's open.
Yeah. So everything is finalized for the location, right?
Yes,
That's
everything is finalized. It's
Because
official.
we had a lot of people from Montreal, and they always used to say, "Is there a way that we can avoid the travel and all that?"
Right.
Yeah.
So we found a
Okay.
way to bring the course. This is an announcement for all the dentists of Eastern Canada, Ottawa, Montreal, people from all around. The ACJ course is now going to be remotely available in Montreal. Just write to us for more information. We will be making more official announcements about this on our website. So stay tuned. Dr. Marwan, going back to our question about the remote course, can you throw some light on how even the remote participants will get personal support from you?
So what we do is, I will dedicate specific time for them. It's like after, for example, to give you an example, after the ACJ exam, we did a session here to see the people after the exam, to talk to them, to connect with them. So we held it here, and then we held a remote session. So I was with the people in Calgary and Vancouver live,
Okay.
just with them, no people from Mississauga.
Okay.
So what we can do is we can, for example, I know that one of the comments they talk about the remote sessions is they get people in Mississauga, they get to ask me after the lecture,
Right.
which is true. Although I try to end the session because a lot of the questions we answer during the lecture, but it's good because people want to feel that support. They want to be able to ask.
Right.
So one thing that needs to be addressed as well for the remote to improve the service there is to allocate session time. So what we can do is one session we take questions from Mississauga, let's say afterwards, and then
Right.
one session Mississauga ends, they have to evacuate, and then we take questions from the remote locations.
Absolutely. So we're fine tuning this process.
Yeah, we have to. It has to be equal service.
Right.
So I think those two things, if they can be improved, then
Yes.
we're in good shape.
Absolutely. So that's it, Doctor. Thank you so much for joining
You're welcome.
us. Thank you so much for joining us, doctors. Thank you for sending in your questions. Once again, a reminder about the ACJ course being available in Montreal. Wait for more updates on that. Thank you so much for joining us. This session will be available on our Facebook page for your reference later. So thank
And
you.
one more thing is
Sure.
we'll be announcing office hours before the course for those who are doing it second time or third time.
Okay.
So I'm gonna announce office hours if they want to come meet me in person just to discuss how to plan for the next cycle.
All right, that's great information. Also, one last thing before we end, you can register for the ACJ course starting now, or the registrations are open. So just let us know if you need any more information. Thank you for joining us. Thank you, Doctor.
You're welcome.